Okay, it is 6:30. We will call this May 7th HHS meeting to order. We'll begin with roll call. Tweet Schuman.
Here.
Kay Wilson. Marshall Savitsky. Chuck Van Etten. I know he's online. Jeff Haney.
Here.
Bill Trepanier. Don Pettit. I think I see Don online. Carol Pearson.
Yes.
Sabrina Dunlap. We have a quorum. So let's all stand for the Pledge of Allegiance. Pledge allegiance to
To the flag of the United States of America and to the republic for which it stands, one nation,
under God, indivisible.
with liberty and justice for all.
Okay, let the record show that this meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes. We will begin with nominations for chair. I will open the floor for nominations for the position of chair. A person receiving a majority of vote of members entitled to a seat shall be declared elected, and this vote shall take place by voice vote. If no majority is reached, we will continue to vote. Once the candidates have been nominated, they will be afforded the opportunity to speak for 3 minutes. So at this time, I will open the floor for nominations for the position of chair. Do I have
Yep.
any?
I'd like to nominate Ms. Kay Wilson for chair.
Do we have any other nominations for the position of chair? Third and last call for positions of chair. Hearing no other nominations, we will cast a unanimous vote for the position of chair to Ms. Kay Wilson. All in favor, say aye.
Aye.
Opposed, same sign. Congratulations. Okay, we will next do the same with the position of vice chair. Do we have any nominations for the position of vice chair?
I nominate Tweet Schuman.
We have a nomination for Mr. Schuman. Is there any second nominations for the position of vice chair? Last call for vice chair nominations. Hearing none, we will cast a unanimous vote again. All in favor, say aye.
Aye.
Opposed, same sign. Congratulations. We have a chair and vice chair. Ms. Wilson, next week or next month, we'll have the signs over at the other position, so both of you can move over, but you're welcome to stay there tonight if you'd like.
We will begin with public comments. Linda Zilmer, please.
Good evening. My name is Linda Zilmer. I'm a resident of the village of Birchwood, but a fourth generation property owner in the town of Edgewater, and under Mr. Van Etten's district. I'm going to repeat some comments I made last month, being that there are new members to this committee. And it's on the subject of your agenda item 15B, the tourist rooming house ordinance. Over a period of several months, an ad hoc committee met to look at the issues around regulation of tourist rooming houses. And I believe it was in February, the draft ordinance that you now see is something that was brought forward by outside counsel. And the concern I have is that it takes some language from zoning ordinance. And the zoning ordinance is also in an amendment draft phase right now too. That has gone on for quite a while. And even the basic definition of dwelling is something that may be changing, which is something that was incorporated into this ordinance. And I think there's also a disconnect with secondary habitable structures. Matt McKay and Jay Kozlowski attended the Sawyer County Towns Association unit meeting and both did an overview of, Matt covered the tourist rooming house situation and Jay talked about zoning ordinance amendments. And I believe if I understood correctly, that comment was made that these secondary habitable structures would not be rentable, but I don't think that that's really what the zoning ordinance says. Anyway, to kind of boil this down, before any public hearing is set to move forward, either this ordinance or the zoning ordinance, I believe there should be a joint meeting of this board and the zoning committee to talk about the issues of tourist rooming houses as they pertain to zoning and HHS. Both those departments have a lot of work to do and may be needing additional staffing. And to put this all on HHS and not so much on zoning is, I think, something that should be discussed jointly before moving forward in ordinance and for action. Thank you.
Is there anyone online?
I see no hands up.
All right. We will move on to consider approval of the minutes from our previous meeting. Do I have a motion?
I'll make a motion to approve those minutes.
Second.
Motion's been made and seconded to approve the minutes. Any discussion? All in favor?
Aye.
Opposed? So moved. Let's see. Since Bill isn't here, do you have any information to bring forward?
I really don't, other than our new health centers. Oh, sorry. Yeah, I'll fill in for Bill real quickly regarding our new health center and the construction of it. We're moving on target as far as opening in the spring of 25. And as far as we know, it is on budget. And it's going to be a great addition to the neighborhood. We're going to have a pharmacy and an urgent care that's going to assist people that live out in that direction. So we're very proud of that. The tribe recently won an award for the financial package that was put in place to build that building. So we're very proud of that. And I guess that's all I have.
Thank you. Senior Resource Center?
I can do a brief update. The written report here is from Ms. Joey Johnson. She is attending a presentation tonight. The Senior Resource Center is one of 5 organizations that have been nominated for a $10,000 award, and they all have to make a presentation tonight. So let's give them good vibes on her being there instead of here, and hopefully they'll get that $10,000. But the meal count was asked for in some previous months' meetings, so the meal count is here. She also has identified that they are still looking for some positions. And we've got the home delivered meal count there for both Hayward, Stone Lake, Excellent, and Winter. As well as, I think she also has, she does have congregate and carryout meal totals as well. So those are included on pages 1 and 2 of her report. I do not know of any additional things that really stand out. We're trying to develop some more fundraising. You can see the fundraising items listed on the report as bingo. And we may be doing some kind of presentation at the steakhouse, but that's still up in the air. So I can't comment on that further. Any questions?
Andy?
Yeah, I think I've mentioned this at last month's meeting and then also at the admin committee. So we're probably all aware that the Senior Resources had some issue with payments or tight cash flow, making payments to drivers based on the reimbursements from GOAR, as well as their staffing issues. So we've extended some help to them from the county through our finance office. And then we are going to have a meeting with our admin, with theirs, as well as GOAR, which is the state agency. We have a meeting set now for May 28th to look at any, operational changes they might want to make.
Great.
Andy, would that include the Waldo Center?
That's all, it's all part of it, yeah.
Okay.
Yep.
Good, thank you.
Our next is number 10, administration.
Did you have anything, Andy? Okay. I'm going to share my screen. Okay. Being that we're kind of transitioning into our new board, I did put together a PowerPoint with some information. It's a very brief overview of the different department areas, but a few of you have gotten information along the way, and a few of you haven't. Kay came in mid-cycle, so she's never seen anything like this. And in addition, we will be updating our board book and sharing that with you too, so that you have things at your fingertips as well, related to health and human services. Let's see, I'm going to see if I can get my slideshow started. Okay. And those of you who don't know me, I'm Julia Lyons. I'm the Health and Human Services Director. Okay, so from a board perspective, as we were looking through our documents, we did find that there was a board mission statement that was drafted in 2017. I'm not sure if it was finalized or not, but I thought I'd bring that forward just for ponderance as we move forward. So the mission statement was develop policy for providing health and human services to Sawyer County residents. Services will be provided in an integrated and efficient manner by coordinating and expanding on existing governmental, voluntary, and private community resources. Assure that budget allocations will support citizen well-being through access to economic support, programs for children, youth, and families, adults who are aging or have developmental disabilities, persons with mental illness, alcohol or drug dependence, and public health or emergency social services needs. So as we move forward, if you decide that you want to bring this back up and finalize the mission statement or rethink on some things, I will put this in your board book too, so that you have that opportunity. Any questions on that before I move through? Okay. The other thing is that the HHS bylaws will be in the board book as well. I noticed that they are not on our HHS board website. So if we want those posted there, I think we should be able to do that, the bylaws. So depending on if you would want to see that there, readily available. And they are also have not been updated or reviewed since 2019. So it's just something you might want to think about looking at and making sure that the bylaws fit with where we're at, or if there are any changes that occurred along the way. So from there, I have a HHS services overview. Again, this is really brief, does not go into any major detail on the programs, but more detail than the services list that was included in the packet. So with adult long-term care and adult protective services, just for everybody's awareness, that building is located on Highway 63. So they are offsite. They're in with the Veteran Services Office. And I think that's been well over a year and a half since that's happened. And for those of you who do not know her, this is Carol Martin. She is the supervisor for both APS and Adult Long-Term Care Unit. Our Aging and Disability Center of the North is actually a consortium, and we serve residents from Ashland, Bayfield, Iron, Price, and Sawyer counties. So that makes it so that we have one point of contact. So no matter when they call in, we always have phones that are monitored, so we share those services. And we provide information and information and assistance for individuals who are ages 60 plus, adults with disabilities, and there is no cost or income requirements to receive those services. The help with that we provide options on to help make informed decisions are maintaining independence in the home, choices for long-term care and related services, Medicare and other health-related benefits, Social Security benefits, and support services and resources in your community. We have ADRC specialists. So we have regional information and assistance specialists. They're the ones that answer the phones, and that's supported regionally. Locally, we have information and assistance specialists that actually do the functional screening and counseling. We have a dementia care specialist on staff and an elder benefit specialist on staff The disability benefits specialists, there's two that support the whole consortium. And I'm thinking Price, and I can't remember the other county. Which other county is in Bayfield County is where they're housed. Okay, that is that program. Any questions on that? Oh, it's not everything. I forgot about adult protective services. So with adult protective services, we are taking in reports of elder adults who are at risk. So the reports of physical, emotional, financial abuse, neglect, or self-neglect of individuals who are 60 or older, and we investigate all of those. And also vulnerable adults at risk for the same types of things. In addition to investigating and managing those reports, we also do community education, information regarding guardianships and protective placements. And so Carol supervises the entire unit, but half of her time is devoted to APS to help support that. So we have a 1.5, give or take, depending on how the week is going. In behavioral health services, Joe Bodo and Alicia Carlson have joint supervision depending on different programs that are in here. The services that are in the behavioral health services are outpatient behavioral health counseling. We'd have a referral to private outpatient counseling. The ones that are in green, Joe is a little bit more involved, or much more involved in. So 24/7 behavioral health crisis intervention and mobile crisis. And behavioral health placements, which would be involuntary placements where we need to get them into a safe place. Operated while intoxicated assessments. We have the Children's Long-Term Care Support Program, Community Support Program, Comprehensive Support Services, Coordinated Services Team, and the Transitions Community-Based Residential Facility. So those are a lot of acronyms and items that you probably think, what in the heck are they? We'll be covering mobile crisis a bit more in the near future, and behavioral health placements. So we're going to focus mainly on some of these C ones, like CLTS and CSP. So Children Long-Term Care Supports is a program that helps children with disabilities and their families through support and services that help their children grow to their best lives in their home and communities. Each county actually runs their own program, although it is supported through state funding. So there are support services where we're helping to have clinical support. We do teaching and skills development. We do management and coordination, so a lot of case management, helping to determine what is needed. Physical aids, so we can help purchase things for helping them be more mobile in the community, and in updating housing so that there are bathrooms that are handicap accessible, that they're able to continue to stay in their home. So there's a number of things that happen in that program. We have 2 facilitators who are quite busy. All the counties have noticed that program continues to grow. Especially here, we've noticed since COVID, we've had more families with children with disabilities that are moving up here. So it's an interesting concept because we don't necessarily have as many resources in our communities. So our facilitators have to be creative in trying to meet the family's needs. The Community Support Program, that offers coordinated professional care and treatment for adults who live with severe mental illness. The clients receive a range of services in the community, and the services are meant to be able to meet the client's unique needs, reduce symptoms, and lead to recovery. One of the things is that this is for people with severe mental health diagnoses, and it's a way of being able to help people who have risk of not being able to work or to manage their daily living, or have risk for hospitalization or institutions. So this program is one that we work with Northland Counseling, and we coordinate with them to provide those services. And that has been happening ever since we have had the CSP program that has been with Northland Counseling. Comprehensive Community Services is another program. This program helps people of all ages to live their best lives, and the focus is on mental health and substance use. So people who have mental illness, substance use disorder, or a combination of the two are eligible to be screened. And then they need to meet the screening standard. So if it's impairing their functional ability, then they're able to get into this program. And this program is completely voluntary. CST is Coordinated Services Team, and this one is a personalized system of care where we're really looking at wraparound services for kids with behavioral health needs. The people that are that can be in this, they have to be in multiple systems of care. So some of those systems of care would be child welfare, developmental disabilities, juvenile justice, mental health, special education, and substance use. And then the final thing that I have in here for talking about is Transitions, which is our community-based residential facility. This is located over by Marshfield Clinic here in Hayward. And this services people who are in need for transitional housing, either related to substance use disorder or mental health crisis. And it's really a way to get them in a step-down level of care that will help reduce our placement costs. So we would use this facility as somebody coming out of a hospitalization who still isn't quite ready to go home. We can bring them into this facility, work on really kind of that normalizing back into being in everyday environment, activities of daily living. And it is meant to be short-term, not long-term. So it's intended to be able to move people out. And I thought I saw Joe come on. Joe is the director for transitions. I don't know if you had anything you wanted to add to transitions, Joe.
Thank you. No, I think you did a good job explaining what we do there. We use it to basically to assist also with the CSP population when they, require more intensive services. Thank you.
One of the things that we're focusing on, did you have a question?
I did, but when you finish.
One of the things that we're focusing on right now is actually we have some grant money left through, that's good through December 2024 from COVID ARPA. And one of the things that we're able to use that funding for is for places like anything for mental health and substance use. So we're able to actually make some updates and get the transitions updated. Things have been well used over time. So we're taking this opportunity to update, paintings getting done. There'll be some new furniture, kitchens getting done. So we'll bring in pictures because that wouldn't be appropriate for us to do a walk through there, but be able to show you. I should have started taking some before pictures. All right. Okay. And yes.
Yeah, Julie, of all these services, some of these you mentioned state funded and grant funded?
Yeah, yes. So some come through block grants, and as we get, some of these are block grant funded, some of the things that we need to support locally. When we start thinking about, when we think of out-of-home placements or that type of care, we never have enough money that comes through grants to help support that. So that does come off of county levy.
Are these what they call mandated services
Yeah.
that we're mandated to provide? And
Yes.
And if they're mandated, do we get state funding supporting that?
We get some state funding, but usually state funding does not completely support that. So one of the things to know as a board as you move forward is it's really important for us to be talking to our legislatures. Behavioral health and mental health is one of the key areas that we don't have a lot of funding for. As you know, also, the Sacred Heart and St. Joseph's have closed down. That's really impacted our ability to be able to serve people not only for mental health, but other services, as Dr. Dunlap is noticing. So as we get through and start talking about those times that we can go down and talk to our legislatures or bring them in, that's going to be important. As we go through also, in the next couple of months, as we go through individually, we'll make sure that we're kind of talking through and clearly identifying those areas that we're finding that they're mandated services that we have to provide, but the state doesn't fully fund us to do that.
So all of these services fall under the levy limit, then we have to try to find the money.
Yep, and so like having a CBRS is not a mandated service. Obviously, the building that we have is not mandated, but we have that building there because it does help us prevent costs, because if we have to place them in higher levels of care, it gets to be very, very expensive. So some of the decisions we make on funding are based on it's better for people of our community and also reduce our costs in our budget.
Are any of these revenue streams for the county?
I would say at this point, we don't have revenue streams coming out of, I'm just kind of looking through. We are able to bill for most services along the way. The OWI would be a revenue stream. Outpatient counseling can be a revenue stream. It depends what we're billing and whether we would have enough coming in to help support, or it wouldn't be over and above the cost of what it has to have therapists on board.
And we can bill for CCS services?
So our CCS services can be billed for, and actually our CLTS program, you'll see that there is a lot of expenses in that program, but that program actually is that is a fully funded program because we're able to pay for, to bill for our case management time. So that works out really well. CCS, we're able to bill for service time. CST, we receive grant funding that fully covers that person, so.
Julia, can you tell me what the age range is at transitions?
Transitions would be adults. So we don't have a cutoff age at this point, but we do look at whether they're appropriate to be in the building. We can't care physically for somebody. They have to be independent for the most part in their daily activities.
No.
She just keeps it on so she makes sure. Okay, that's behavioral health services. Children, youth, and family services. This is a complicated program. And we have, under our program, we have Child Protective Services and Youth Justice. That's under Sarah Anzowskis, who, she's not here, is our new supervisor for the program. So when we think about CPS services, I just wanted to kind of bring forward that we're really looking at having staff that cover 3 areas when you think about child protection. The first one is the access stage, and that's where we receive information about suspected child abuse or maltreatment, and this comes through either community members or mandated reporters. And then we use this information to determine whether that report should move to the next stage, which is the initial assessment. Through the initial assessment stage of it, that's when we're gathering information. We're interviewing people who would have been involved with the children or the parents. It could be doctors, educators. We'll visit the home, and we'll use this information to help determine whether there is safety concerns in the home that needs to be further addressed. And then from there, if we do need to keep them going, then we have what's called the ongoing stage, where we're providing services. And those services will depend on what we find from the family, what their needs are. We may be helping them establish goals. We may be helping them with financial things. We may be helping them with parenting or anger management, and we refer to other resources to help with that as well. So that's kind of what that looks like in a nutshell. We've been very, very busy the last month and a half. Lots of cases coming in where we've had to remove children from the home at this time. So. Other services that we have on the CPS side would be court-ordered supervision. We do foster care and kinship care, so we're licensing and going out and doing training, guardianship, respite care. And we have the Indian Child Welfare Act, which is, you'll see ICWA said a lot, and we have a lot of acronyms for those of you who haven't been around HHS language. We have a lot of acronyms, and this is where we work really close with the tribe, and we each have different responsibilities as we move forward. One thing that you'll be seeing coming through is our 161 agreement, which is just an agreement that explains what each of us does so that we're very clear on what responsibilities lie in what area. So, and these pictures are up here because we tapped into some donated dollars that we received, and we updated this family room. This is, it used to have an old dining room table in it and just a few old things in there, and that's where we would do if we needed to have supervised care visits. But now we're hoping to have this be a nice environment to provide those visits in. So everybody's feeling very positive about that. Even thinking where economic support could bring families in, they could use their iPad and they could help them sign up for services in there and be able to keep the kids busy.
Julia, where is that?
That is right. So the CPS area is located on the second floor. So the UW conference room, those doors there, we go right in there, and that's really the CPS side. So it's just the first room in. YJ also falls under Sarah, and this is the youth justice system. And Wisconsin is looking to incorporate focus on prevention and diversion with the provision of accountability and services to youth and family to prepare them to thrive. That's their vision. Things that happen in the YJ program happen at the local level. So although this is something that is a state system, it is managed at the local level. We provide intake. We do assessment through youth assessment and screening instruments. We have court-ordered supervision, provide case management, out-of-home placement, restitution, community service, substance use testing, and electronic monitoring. So this would be if somebody, if a youth was involved with any law enforcement, they would make a referral to us, and then we would go from there. So, and again, this is something I've noted previously, but we are seeing very high case numbers in this area. This is an area we're going to want to watch closely. Our out-of-home placement costs are definitely higher than we had anticipated. They could level off. We hope that they will, but we'll continue to watch that as we move forward. In one other piece with that, the reason why out-of-home placement costs would be higher than what we anticipated is that we're actually having kids that fall on a higher acuity scale where it's been more severe in what they've been caught doing. There's been definitely guns involved and different things that bring us to a higher level of need. Okay, economic support services. This is another one that we are in a consortium. It's the Northern Income Maintenance Consortium. And so you'll see NIMIC often, that's how they say that. And that's a partnership of 12 counties that includes Ashland, Bayfield, Florence, Forest, Iron, Lincoln, Price, Rusk, Sawyer, Taylor, Vilas, and Wood. Anyone in these counties that would call the Northern Income Maintenance Call Center and apply for benefits. They can report any changes to their case, they can check benefits, process eligibility, complete reviews, ask questions about all of these programs that are listed here. So you think about your Badger Care, any of your insurances, long-term care, family care, food share, child care, and Wisconsin caretaker supplement. So all of that happens within there. We have employees that work directly through each of the counties, but we support regionally and all work together as a team. And that's how all of these are in consortiums throughout the state. There isn't anybody who is independent. Perhaps Milwaukee, I should probably caveat that, I'm not sure, but the rest of everybody actually functions, and this is how the state has them functioning. The one thing that we do provide that is locally for the programming is and actually I should step back. We have people that are here, so if somebody wants to come in and see somebody in person, they can do that. So because I'm saying this is the only thing we provide locally, this is the only thing that is not run through the consortium. So the Wisconsin Energy Assistant Program, which is WEAP, and that is for assist households with heating and electric who meet the low income requirements. And again, this is not part of the consortium, but something we do locally.
Julia, when you have the report, it has like 8,900 and so many calls.
That's for the entire consortium.
Yes.
Yep.
So how many people answer phones?
Oh, that's
For
a good
the-
question. That's a Shauna question. She'll be here next month.
Okay. I bet they never answer their phone at home.
Probably not. I can't imagine. They are on the phones all day long. And each program has a certain amount of people that cover the program, so they don't have to be a specialist in everything. So they would each kind of cover their own pieces. Public health. With public health, I'm going to kind of cover this in the functional areas, sort of. Julie will cover those more as she goes through every month, but it kind of what we block public health into. So communicable disease prevention and control. So what we're doing there is monitoring and investigating communicable diseases. They advise for healthcare staff on isolation and quarantine measures when there's outbreaks. They communicate current information on what we're observing both locally and at the larger scale. We have animal testing for rabies. We provide health promotion and mass flu clinics. For chronic disease and prevention, there's also surveillance with that, health promotion on social media, community events where we're promoting. Well Women program, there's Narcan training and distribution. We have a peer recovery coach and the community health assessment plan where we're really, at least so far right now, focused on mental health, substance use, and trauma-informed care. From an environmental health standard, we do surveillance and investigation of human health hazards. We also do surveillance and investigation of food and public safety, so responding to complaints, assisting with food recalls, investigating foodborne illness, promoting safe food handling practices. We have a certified water lab and water testing. We participate and promote in drug take-back events and along with disposal of medical sharps. And we are an agent of the state for inspections and licensing. So we have the retail food, lodging, public pools, campgrounds, and summer camps fall under the state licensing for that. Maternal, child, and family health, we connect families to resources such as Northwest Resource Center. There's health promotion and prevention, so we are looking for positive perinatal outcomes. That's a focus right now. Strategies to reduce childhood injuries and suicide prevention when it comes to children and family. We have a child death review team, and that always sounds ominous. So I'll just explain a little bit more. Whenever there is a death of a child, and actually we go up to age 26, if I remember, 29 maybe even. Okay. So because people of that age should not just die unexpectedly or just die, especially with young children. So what we do is we have a child death review team that looks at that death and determines if there was something that could have been learned from that. And then we put it into a database and we can compare and see if there are some risk factors. And then that helps us for actually educating the public in what to watch for. I know at one time, carbon monoxide was a big thing. We were seeing a few deaths that didn't just all happen together, but in different areas related to camping and using generators and the carbon monoxide from that. So education went out for people so that we could make sure that we were trying to prevent any unintended deaths. We also have the Women, Infant, and Children's Nutrition Program. We have a sexual health clinic and the Birth to 3 program. Birth to 3 program, I should kind of go over because that's probably something some people might not know. That's for children with developmental delays that are under 3 years of age. Once they hit 3 years of age, then they get referred on to the schools. So we have people that would come into the home, therapists that would come into the home and help with those delays and educate the parents. It's intended to be that we're teaching parents how to actually do the therapies. We're not having them do major manipulation, but even learning how to talk and giving them suggestions, so a lot of times can really help with the delays and catch those children up. Emergency preparedness is a big piece of what public health does, planning to respond to various emergencies. They participate with schools and law enforcement and training exercises. They're updating emergency procedures, coordinating with our emergency manager. And the other goal is to establish and maintain community readiness. And our Medical Reserve Corps is, you probably, I hopefully will see some advertising and some people coming forward and looking at that. We used Medical Reserve Corps during COVID to help with vaccinations. So that was extremely useful. People don't have to, we are not looking for people who would have a medical background, even people who could be a receptionist or guide people through the process. Those are all important pieces. So right now we're looking at recruiting and training volunteers. And I think Joyce has a number of events, community events planned that the Medical Reserve Corps will be participating in. And Julie McCellum is our health officer. She is sitting right over on the edge there. I think this might be one of my final slides. Our mission statement and core values for HHS are to respond to health and safety of Sawyer County residents, promote the self-sufficiency and general welfare of the individual and the community. And our core values are collaboration, respect, communication, and integrity. And I know I have one more slide because it is Mental Health Awareness Month. And I put this at the end because you can see that by many of the services that we give to the community through our department, a lot of them are linked to mental health. And it's a time for all of us to reflect on what we're doing for our own resilience so that we can continue to do the work we do. Okay, that was long-winded admin report. They're
That was
not
great.
always that long.
Is that going to be in our booklet?
Yes, I will, and I'll add to that a little bit. We'll make sure that that's in your booklet to be able to see, as well as some of even the brochures and different things that we've got.
Thank you.
Thank you.
I got a real quick question, Kate.
Mhm.
How many employees does Health and Human Services have? How do you pull off all that?
For, well, it's very, very tight. I think everybody has asked me for more employees, so just so you're aware.
Yeah.
We have 48, I think, right now. So the additional people that are behind the scenes, and we'll talk more about these as we move forward throughout the months, but we have a fiscal and clerical team that helps support that really don't even get noted in this program talk because they're answering the phones and getting stuff pulled together for us and doing all the stuff behind the scenes that allows us to keep functioning and keeping our sanity. I'll in your report, in your board book as well, I'll have an org chart in there so that you'll be able to see that a little bit more clearly and where vacancies are along the way. Okay.
Moving along, we'll have the report on adult long-term care.
Do you have any updates? Okay. We're just going to go, you can pull up her long-term care report. And actually, it was supposed to be attached in our new agenda. It is, right? And so what Carol did is she pulled together a lot of information about the ADRC and APS. So that information is a little bit more detailed than what I went over in the report. She used this to help train all of our staff at our all-staff meeting, and we'll continue to give things like this out to our new employees as well. Okay, and just so that people can hear online, May is ADRC month. And that was proclaimed by the governor. There's a lot going on this month. Okay, at that, unless you have any questions for Carol, we can end that report. Do you want me to keep moving through?
Behavioral health is
Okay.
next.
Okay. So with our behavioral health report, if I can get to my section. One of the things that Alicia and I have been really doing is looking at the programming, and where we're seeing the needs in the community and maybe trying to do a little shifting in, what people are focused on. We'll still continue to have all of our programs, but really looking, at kind of focusing in where we think that people would have an ability to connect to another program. So thinking about crisis in the community, there's linkage services that we can be doing internally. So we've been having conversations with the team on how we can work with that, with Northland Counseling, with Joe, Alicia, and Haley as we move forward on that. And then just looking to see how we can better support CLTS along the way as well. They are swamped and really struggling with keeping up. So if there's ways that we can help them on the back end, with clerical support and other services. So just kind of making sure that we're running as efficiently as possible with these programs. The other thing that is in here is the mental health monthly expense report. It's pretty early on in the year for us to really be determining where we're at with things, but so far, and I hate to even say that, so far we're doing okay. You never want to speak too loudly on that. So as we move forward, you'll be able to see in that report, which is, yep, you got it up. Sorry, I forgot to tell you to move to that. We can kind of see some of the areas that we tend to spend some of our funding. And as we look at this, we do get reimbursements along the way as well. So those are usually in the back pages when we talk about our purchase services and our recap. But this really lets us know what it costs us upfront before we get any of those refunds back. Questions on behavioral health? Next month, I think Joe's going to have his mobile crisis information all pulled together. So we'll be able to talk about crisis reports and go from there. Okay, if there's no questions.
Is behavioral health where all of our out-of-county placements for adults come from?
Yeah,
Is that-
for adults, yep.
Yeah,
Yep, for adults. All our youth would come through CPS and Youth Justice.
and we budget for out-of-county placements, because I know that can be.
Oh, out of county
Sorry.
place, yeah, yeah, we tried to place in county as much as possible, but yes, we've done quite well with making sure that our budget meets our needs, at least. Over the last couple of years, we've been able to stay within budget. There was a time when we weren't budgeting nearly enough to be able to make those coverages, and then we were kind of having to dip into the coffers. So hopefully we're right on target this year. And again, I think, one of Joe and I have been talking, and some of the things that we're really trying to do is make the best use out of some of these facilities. The other thing that we've been talking about is there are some expensive placements that are sitting out there, and is there an opportunity to get an RFA locally to see if anybody would be willing to have like a group home environment to bring some people back. We have a couple of our placements are very high needs, and it's 2-on-1 for being able to provide those services. So that's very expensive.
Before we go to Child Protective Services, we missed the Purple Tube project up in adult long-term care. Did you want to speak to that?
Is it
That's on my.
on the agenda?
On the online agenda, is there?
Yeah, we talked about that last week. We can, I mean, if you,
We don't have to.
it's last month.
Okay, all right.
Yeah, but I did that last month.
Okay. So,
It is, the purple tube is for provide, we can just, now that we raise that subject, it's information tube that people if there's somebody in the home who's living with dementia or Alzheimer's, you can pull information together and keep that information in the tube. So if EMS or law enforcement needs to come to the home, they're able to access information that would be important to know as they move forward. That's also information that's shared with dispatch. So dispatch would tell law enforcement or EMS to be looking for that. So project that we're hoping to see more people utilize. Okay.
thank you. So Child Protective Services and Youth Justice.
Okay. There's a lot of terms in youth justice and CPS that are difficult to understand what they mean. So right underneath this report is a glossary of terms for youth justice. I'll have one created for Child Protective Services, but we did kind of talk about what access and initial assessment looks like and previously as I was talking. So that hopefully helps you have an understanding. In March, we received 15 reports and we screened out 6. And when we screen out reports, we always refer them to Northwest Connections. So they didn't quite meet the needs that would get them having to have Child Protective Services supports, but we also don't want to just leave people hanging because we don't want those reports to come back in. We want those families to be successful. So we always refer to Northwest Connections to go in there. We have 28 out-of-home care placements at this time. 20 of them are CPS, and as you can see, we have 16 in non-relative foster homes, 2 in a relative, and 2 in kinship. And youth justice, we have 8 out of home. 3 are in Lincoln Hills / Mendota. Those are expensive placements. 2 in residential and 3 in secured detention in Eau Claire. That is an expensive placement as well. And that's why we want to make sure that we're watching our costs along the way. Yes.
I'm just going to add that over the last year, the out-of-home care, the foster care, relative foster home care, I think they've done a good job of bringing some of those youth back to the least restrictive placements.
Yes, actually, very good point.
Yeah, those have been good. The youth justice side, though, has also changed in that we are having more, like Julie just mentioned, the Lincoln Hills, Mendota placements, residential, those are expensive. And we have not had those these numbers for quite a while. The other internal domino is that more cases are being referred over from our youth justice workers to the DA's office. And so the DA's office has communicated that they are, and to be honest, that was not happening before.
It wasn't, no.
So that's been an adjustment within the offices to coordinate their activities.
Yeah, so it's happening so much that they're even calling Sarah saying, I hope you stay with us because it's a lot coming in there and it's overwhelming for everybody. And very good point, Andy. Over the last year, and that was kind of the end of the year reporting that we had done, we have shifted a lot of kids out of into more permanent homes, have done a really good job over the last, it was really probably starting in June through December that most of those placements. We're still waiting on a couple of permanency hearings to get those kids in a permanent placement. But yes, things are looking much, much better on that end. And for those of you who do not know it, that is a brand new staff, basically. Our entire team, I think, all but 2 have been hired since last May or April. Yeah. So. Youth justice, glossary of terms, it's just something that I mentioned. I will keep these in here just as reference material. We don't necessarily have to go over them. And I will put in one for CPS too, just because that is a for many people, we use a lot of terms that we don't really know what that means, so. And for the youth, thought I had another one for youth justice side, or did I go through it already? Oh, I just had the glossary terms in there. Okay. Okay. And then the reports that are following here are the children in care reports that just helps us track our expenses as we move along the way. Any questions on that? Should we move on?
Oh,
Yeah.
I was looking at the report, sorry.
Okay.
Economic support.
Economic support, the update has been provided by Shauna. As mentioned last month, we are having a lot more calls coming in just due to the unwinding process still. However, we're still at a 95% answer rate. 46 is the longest wait time. We need to include the average wait time because it's really not that long, and it's surprising how quickly they get through. When we do have some of the longer wait times, it's typically on the disability side of things where they're having to ask a lot of questions, and those calls are very complex. So I do know that they do quite well when compared to other consortiums, so we're pretty proud of that. And in addition, another proclamation for this month, it's a busy month, Economic Support Specialists and Case Managers Week is next week, May 13th through the 17th. Any questions related to economic support?
Public
Okay, public health. She's got her reports here, but I think Julie wanted to comment on one thing that she wanted to make note of.
Julie McCullum, Health Officer. I did just have a couple of additions. Since I submitted the written report, we did submit our 2023 annual report to DHS. It is posted on our webpage, so if anybody wants to go look, and you can look on our public health webpage and go to health topics, and our annual reports are listed there. But I'll make sure that you have the link in the next month's report. It just was after this report was submitted. Also, I wanted to encourage everyone to do the community health assessment survey. So hopefully you received email information on that, and it's also included. The link is included in my report. We are encouraging all Sawyer County residents, and if you live or work in the area, to fill out that. That actually drives our community health improvement plan. And we do this in cooperation with Tamarack Health. So this is a 3-year cycle, and currently we're doing the survey process through the end of the month. So just encouraging you to fill that out. So, okay.
How are you notifying the public? I got an email, so I had the link to that survey, but are you putting some information in the newspaper or on the
Yes.
radio?
Yes, both of those. Also, we've sent a mass email out to the Chamber of Commerce, working with LCO and their newsletter and their agencies there. We're working with LCO Clinic, and we have representatives in different facilities who are supplying paper copies. So if there's a link, if the website survey is an issue, we're also providing paper copies. So yes, the hospital sent it out to their contacts. I know I have sent it out to our community contacts as well.
Thank you.
Good question. No? Okay.
Tourist rooming house draft ordinance.
Okay, well, we brought this to the committee last month, and I'll just do kind of a brief recap of what we have done. So it's been about a year ago, a little bit more than a year ago, actually, that We brought this to HHS board and the zoning board about potentially looking at an ordinance for tourist rooming houses. And from there, the boards brought forward that they'd like to put together an ad hoc committee to look at this and bring back recommendations. The committee met a number of times, brought forward some recommendations and kind of a beginning of an ordinance. The other thing to note was that we tried to put an ordinance through back in 2017, somewhere back in there. And that wasn't successful, so we worked with that and the additional ordinance that came through. It was requested then that we have a small group of people pulled together internally to make sure we were addressing everything we needed from a zoning and health and human services perspective. Along with that, we had legal counsel that walked us through what shouldn't be in there. And we also worked with a template that other Wisconsin counties may be looking at using. So we brought forward a number of changes. We slimmed things down and brought that forward to the Tourist Rooming House Committee. From there, recommendations were made. We went back to the table, pulled some of those recommendations in, and then brought it back for final approval. Again, it wasn't final approval saying that the ad hoc committee felt that this was done and ready to go, but they felt that it was at the stage that it should come back to the committees of jurisdiction. So that's where we're at now. We are at committees of jurisdiction to look at the ordinance and determine next steps for moving forward. One thing that is in the recommendation from the ad hoc committee is that we do have a public hearing so that we are getting full comments on that as well. Andy, do you have anything further?
Yeah, I think just maybe a couple things. So yeah, one of the things tonight, based on last month's conversation, was to set a public hearing date so that committee can take public input on this and then use that public input to make any changes before you would most likely send it on to the county board. It is did come out of the ad hoc committee as a health and human services ordinance. There are zoning components in here that the part of the licensing process will be verification from the zoning department on septic system sizing for the unit, as well as the secondary structure. If zoning, it's an inhabitable structure or not. They can only rent it if it's been approved by zoning. And I think just to answer maybe some questions that have come up in the last month, I heard some things at the Sawyer County Towns Association meeting last week. There is going to be some work that needs to be done on enforcement, not just of this ordinance, but of our zoning ordinance as well. So I guess we're keeping that in mind, but a lot of the ordinance in here, this is intended to be a health and human services license that will be a county license. We are an agent of the state through public health that already issues state licenses for restaurants and accommodations. And so this will be a county ordinance and a county license for tourist rooming houses. That's really meant to be seamless. When they're applying for their state license, the county, our staff will be working with them to issue them a county license as well, should they meet all the requirements set forth in here for the license. So I think it's 12 pages long. It seems like a lot, but when you break it down, it has that kind of a page of, the position and the outline of why there's a license, a couple pages of definitions. It goes through the license process and the requirements for that. And then there is, the enforcement or the ability to implement accountability with these properties. So, there is if there's complaints, and I forget the exact language, but I think if there's 3 complaints, the license could be suspended and there could be a hearing, and there's appeals to that decision by the staff. This board would be the ones to hold the hearing for any appeals of licenses that are suspended or pulled. But that's something we didn't have the luxury of doing before. At least now we have, should this ordinance get adopted, there's a way to address licenses and suspend licenses if they're not fulfilling what's in our ordinance. The other thing I'd mention with accountability, and this is based on some comments I've heard, is, if there's fireworks being lit off on a Saturday night at one of these properties, our public health staff's not showing up to address that. And it's still a call to law enforcement if there are immediate things, but it gives also law enforcement some tools to deal with these properties. If there is a way we can take complaints into public health and follow up on those. But there is not going to be like instantaneous, we're not going to have the tourist rooming house police patrolling neighborhoods, but it will allow us with complaints to follow up on these properties and hold them accountable. The other thing, I don't want to say self-policing, but these are residential properties, usually in residential neighborhoods. And normally, if you have a problem with your neighbor, if you're not a tourist rooming house, the first way you should handle that is by going over to your neighbor and saying, hey, your dog's making noise. Could you do something about that? Or, your relatives are coming over and they're parking on my lawn. So we want to have that kind of engagement happen. So that's why there's, some provisions in here for local agents. So if there is a local person within 60 minutes that can respond if there are complaints, you have to notify people within 100 feet of the property line that you're operating a tourist rooming house and provide that contact information. So we want people to be, the tourist rooming house owners to be accountable to their neighbors. And if they're good operators, they're going to try to make sure that the neighbors aren't complaining about them. So there's some responsibility there that we're trying to build into the ordinance. So there is not as many calls to law enforcement or public health staff, at least not initially. If that doesn't work, then there's a process that can be followed through to make sure that these operators are doing the right thing.
Andy, there were a couple changes right at the end, and I think you hit on them right now. Have to live within 60 minutes of the facility. Is that the owner or the person that they put in charge of that?
It could be the owner. The owner can designate themselves as the local agent if they live within, or if they appoint a local agent, they have to live, and they have to provide that with their application as to who the local agent is.
Right.
And I think, we did settle on 60 minutes.
Yeah,
And
I
then the
remember that.
notification of property owners, that changed around numbers, and I think it settled on 100 feet.
Is 100 feet enough? I
of
mean,
the
that's
perimeter of the property.
The perimeter of the property.
Yeah,
perimeter. So if you're 200 feet away, you don't get notified.
right. Again, though, to me, the message
I know.
in addition to an ordinance, I think our staff has done a really good job of putting together educational information. And to me, if I was a tourist rooming house operator, I'm gonna make sure I have really good relationships with my neighbors, and I might go out beyond 200 feet, depending on how close they are. Depending on how big your property is, you might want to consider what's in your best interest to keep the neighborhood happy.
The neighborhood's going to know.
And we're going to collect a license fee. How often? Every year?
Every year.
Every year.
Starts June 30th, I believe.
Okay.
And
that's going to offset all the enforcement and the staff HHS is going to have to put on to police these, or?
that's what
We're not-
HHS does semi-annual, or not annually, but maybe biannually, is look at the cost of operating these and adjust the license fees appropriately. And it'll be taken into account in enforcement as well.
Marshall?
How will law enforcement know that it's a, tourist house?
Yep.
I forgot I shut it off. We're going to be able to, we want to map out all of the places on GIS that would be available for dispatch. So there are a number of things that they look at, like if there's a purple tube in the house kind of thing. They'll be able to look that up and they'll be able to notify law enforcement then that it is a tourist rooming house. We don't know that it's occupied by a tourist rooming house, by a client who's renting, but at least they'll know that. So then when a complaint comes in, law enforcement, that can get back to us. And then we can make sure that the owner knows about the complaint that came in. So we're hoping that, I know it's going to be a little bit of work to get that in place, but hoping that process helps us really get a better understanding of what's happening out in the communities.
And the occupancy and the septic size, is that going to be consistent with other state models, or I know that the attorney mentioned that, right?
Consistent with the
State.
debt cap.
It's, with the septic size,
Mhm.
that's consistent with DSPS.
DSPS?
Debt cap is ours.
Okay.
DSPS is the septic. So for the pout systems, the private. I believe I'm speaking correctly. And maybe one other one. I
Actually,
think I look back in there. It's consistent with what they regulate their septic systems with if it was a residential house.
So the public hearing, will that be tied to a Health and Human Services meeting or a zoning committee meeting?
It's up to this board. If you want to make it part of your meeting or have a separate day altogether. Or you want to take in the public input.
I think from the last zoning meetings, they said that they had no jurisdiction and just passed it back to us.
Right.
So it should be with one of our meetings.
I believe so.
So we would hold it like prior to our Health and Human Services meeting next month?
That's what
Did you want it
do.
sooner, as soon as that, or?
Yeah, we did want, even though it's not required, we still want to do like a zoning public hearing, do a class 2 notice for 2 weeks. So we're looking 3 weeks out as it is.
So zoning has the animal control and the zoning officer. I forgot what her name was just hired. I'm guessing she would be the one that would be addressing some of these concerns. I kind of think that maybe because she's part of the zoning process, I wonder if that should go under zoning more than us, because they would know the requirements.
She's not a
for-
zoning employee.
She's not
No.
a part of that?
She's actually under admin
Okay,
because she does animal control, but then she also does work for public health and zoning.
okay.
Yep, she has the trifecta.
So do we need a motion to set a public hearing then?
Yes.
Do I hear a motion?
I'll make that motion. We set a public hearing with our next Health and Human Services meeting.
At what time? Before, like at 6 o'clock or 5 o'clock? Do we?
Or can it be part of our meeting, Andy?
Yeah, you could start it at 6:30. Yep. Public hearing would be at the start of the meeting.
Yep.
It'd be June 11th. Nope, is that right? Yeah, June 11th.
All right, we have a motion for a public hearing for June 11th for the tourist rooming house. Do I have a second?
And I'll second.
Motion's been made and seconded for the public hearing. Any further discussion? All in favor?
Aye.
Opposed? Motion carries. Okay, fiscal. The budget.
Yes, so enclosed, you'll find your standard budget reports. And it's pretty early in the year for us. The only things that I am concerned about at this point that might be out of range is just really watching to see what happens with those out-of-home expenses for youth justice. And probably for travel expenses when we're needing to transport people for both mental health and youth justice. We are having some travel expenses with those. So we'll want to keep an eye on those two things, but at this point, everything else, nothing else is standing out to me as having any concerns. Does anybody have any questions? A lot of numbers to look at. Is there anything that you would like to see differently in the report that would make it easier to understand, or do you want that much detail? We've kind of added some different reports along the way. Or do we just keep going the way we're going?
I guess I'd just like to see that we're tracking with the budget,
Mhm.
and an actual, the budget could show us where we're at and that we're not having variances that we need to put in check.
Mhm.
When I look at
And
the
maybe we do
budget, I look at the percent used and received,
Mhm.
and that kind of helps me understand where we stand.
Mhm.
We did talk about reporting revenue at one point.
Yep, we do have the revenue recap report, which is in here as well. You've got the purchase services recap, and I think I called it, oh, it's a revenue, it's a receipt. Oh, she calls it a receipt recap.
Oh.
I can, receipts mean you took money in and you wrote a receipt, kind of old, it's accounting language. So that's those, are the funding streams that are coming in and, with the budgeted and the percent that we've received, so.
So anything in the HS receipt recap,
mhm.
that's money coming in.
That's money coming in, yep.
It's gonna be with the purchase services, you know, even there, it's a month behind when the expenses are incurred usually, and the receipts could be
Couple months.
2 to 4 months behind.
Mhm. So it's always delayed, so we
Yeah.
kind of got to get it into the year a little ways for us to be able to start seeing where things are at. But I hear things, so I kind of know where things are at. Because when you look at the youth justice, it doesn't look like it's out of check yet, but that is my concern.
What is the line item for the travel expenses?
It will be, it's called secure detention travel transport. So under juvenile justice in the purchase service recap, it's under that. So, you know, I know we've already expensed, even though it's not showing up here, it hasn't hit our accounts yet. And then under mental health, there should be also, I know we're counting it. She might be counting it somewhere else. Nope, transports. Nope, that's Winnebago. Oh, she might have missed adding it to this because we want to keep those separate in here. So we'll keep watching that. Unless somebody else sees it, I'm not seeing it. I'll add that, make sure that that's called out as travel. So it's really that secure detention that we're needing to have to transport people.
For the adults, it was in the
Was it in there and I missed it?
behavioral health report. The mental health expense report it had.
Oh, she just has it in there and not in
Yeah.
this one. Okay, thank you. I know I had seen it somewhere.
Yeah.
Okay.
At one time, we talked about the acronyms of Health and Human Services, and there was the possibility of a list was going to be made,
Do you want,
like from A to Z, like,
so we started, did I put the one in for,
I
you know,
know
that's what got me.
they are in the reports, but it would be nice
There
to
was
have
an
a
acronym
list.
report. Yeah. Nope, we missed something. There is an acronym report for behavioral health. Do you want one in each subject area or do you want one just total? Total.
I think that, personally, I think that just A to Z.
Okay, we'll keep that up in the admin part of it then. We'll just have it as a standing. So I'll pull some of those other ones out and do it that way.
Great.
Julia, you haven't said anything about the opioid money or that budget.
No, that
Is that
one,
not part of your report or?
typically not here. We talk a little bit from CJCC perspective, but we
Oh,
haven't
okay.
really. But I can talk a little bit about it because I know about it. So,
Right.
so for those of you who do not know, we put together an opioid plan for how we would do education and We looked at it from harm reduction to recovery to treatment and prevention. Thank you. Looked under each of those categories, created a plan for the year, and then we were able to use funding sources from HHS from some things and from the opioid settlement dollars. I don't have the exact dollars in front of me from the opioid settlement, but what I can tell you is we're not spending as much as we thought we would need to be spending because we had grant funding become available that we could shift over from HHS. So anytime that we can do that right now, we are doing that because that funding that would come through is going to have stipulations on it that it has to be used by this time and for this thing. So if we could move it forward towards the opioid plan, we did that so that we could save as much of our settlement dollars. Those don't have an end date to them. So we want to be really smart with how we're using our funding. And you'll hear me call it braiding and blending funds in order to get to where we need to be at. So we, again, used up a number of things and now, and we are spending opioid settlement dollars, but we just haven't spent it to the point that we thought we would, so we should have some carryover. The other piece with that opioid settlement, just so everybody is clear, there is a document called Exhibit E, and it has specifications on what you can spend opioid settlement dollars on. It's a pretty broad range of things, so we can pretty much make anything fit into that we would want to move forward with, but we can't like go spend that money on street repair or whatever. They put that stipulation in there so you couldn't pull your funding into other areas of local government. So we can easily meet those needs in our area though.
You have a hand up, Ms. Pettit?
Oh, Ms. Pettit?
Dawn?
Oh, Dawn, you're muted.
Yeah,
Oh,
yeah.
there you go.
What I need to know, as we've sat here and talked again about opiate funding and I seen the fentanyl signs go up. As we've sat in this meeting, there was a drug overdose in Radisson. And this is where I've been on this since 2018. And this is where my frustration lies because we've possibly lost another member of our community this evening. So I love the posters, I love this, but it comes down to we don't have the programs.
We have started with a recovery coach and a number of, we have a recovery coach internally. We are reaching out and connecting with community resources. I'm not going to say that we've got everything in place that we need to have. The other thing that needs to occur is people have to make that choice to come into recovery and to go into treatment. So it's those connections. And by really getting out in the community and helping people understand and having conversations with people who are using, and helping guide them to the resource or being that person that is just always there asking if they are ready, is one of the big key things. So really building community and having those talks and helping people feel safe having those talks is part of moving us in the right direction. It's extremely sad. We have lost, actually in the last number of weeks, I don't have confirmation that they truly were overdoses, but it sounds like they were. So yes, it continues to happen. And despite the fact that we have a lot of Narcan out there, that is not necessarily preventing deaths either. So
I guess my next thing would be with how far gone it's been since before 2018, we went into COVID. These individuals are not going to seek help because they're either deceased now or they've moved into where they're making the money or they're so far gone. Their families are all broke up. We don't have housing. We don't have jobs. Then my frustration lies in we're talking about Airbnb ordinances when we have individuals that don't have housing, that are roaming the streets just looking for some place to stay. And then you have children where you're just saying that there's more and more children being taken from the families at this moment. That plays into it as well. So within the county, there's not housing available for anybody.
And
It's very, very limited.
I'm not sure if that's been a topic that has been something that's been looked at in other economic development. So, and as we move forward, we understand that there's the housing situation as well. That's a long-term solution and not sure where that lands at the moment.
I'm sorry, go ahead.
I'd say just the general subject of housing was not a part of the tourist rooming house discussion on limiting rooming
Oh,
houses.
yeah, we can't.
Should make them available for housing, but in the Economic Development Corporation, they are working on what they can with the housing issue. I mean, there's housing units going up, but unfortunately they're going up at $1,600 a month rent or $350,000 starting rate. So they're trying to determine how to bring down what can be done to bring down the cost of housing so that people who are employed in the community can afford it.
I got a recent email from Tammy Baldwin announcing another $17.7 million for fentanyl and opiate crisis under the State Opiate Response Grant Authorization Act.
Did it say what the use is for? No.
No.
Yeah, usually what they'll do is they'll put out specific, because they have to turn so much money around and give back. So they have to figure out what the needs are across the counties and then allow us to apply for those grants.
So that will be coming.
That should be, and a lot of times, so some of it is the law enforcement deflection grants and different things have come through that opioid settlement grant. So we're trying to always watch for those resources along the way, because that is funding that is out there that is supposed to be spent on that. So if we can get that, then we're not spending our own funds.
Well, watch for your email from Tammy.
I will. May have to forward it to me. I think Joyce receives the emails from her. So.
Is there any other future agenda items? Any other correspondence or reports from conferences and meetings?
I guess just so we add the public hearing. Just so we add the public hearing to our next meeting agenda.
She's got it.
Okay, any other information? If not, we're adjourned.